Hi everyone, welcome to the video of the upper limb bones, and I'll describe to you in this particular video the bones that we find in the upper limb skeleton. So in this video I'll provide an overview of the bones we find, 1 to 3 key landmarks for each bone, and then at the end of the video we'll take a look at a practice quiz so you can practice using this information. So in this video I'll describe to you the following bones. We have the pectoral girdle, which is composed of scapula and clavicle. We have the arm composed of humerus. We have the forearm composed of radius and ulna. And then we have the wrist and hand composed of carpals, metacarpals, and phalanges. So the bones here are listed from proximal to distal. The pectoral girdle helps anchor the remaining bones to the axial skeleton. And then we're moving distally as we talk about the arm, forearm, wrist, and hand. The most distal aspect of the upper limb skeleton then is the wrist and the hand, and technically the phalanges, the bones of the digits. So the top part of the image from left to right, jogging your memory here, because you saw this in the introductory video as well, but we have scapula, then we have to the right of the scapula we have humerus, then we have ulna, and then far right is the radius. Then the bottom part of the image we have the clavicle, far left, and then to the right of that is the wrist and hand, composed of carpals, metacarpals, and phalanges. So the scapula is commonly known as the shoulder blade. See that in the image to the right, and technically the posterior aspect is facing you in this particular image, and you know this because the structure called the spine of the scapula is facing you. So along with the clavicle, it helps anchor the rest of the upper limb bones to the axial skeleton. So it helps anchor arm, forearm, wrist, and hand to have an anchor point so we can actually then move our shoulder joint and it's firmly anchored to the rest of the skeleton. So a key landmark here is the glenoid fossa. Once you see this facing you, you know right away that you're looking at the lateral scapula. So the shoulder joint is considered a ball and socket joint. The ball for this ball and socket joint is the head of the humerus, whereas the socket then is this glenoid fossa. And so the head of the humerus firmly anchors into this particular part of the scapula. The clavicle is commonly known as the collarbone, so along with the scapula is the other component of the pectoral girdle. So it has a medial end and it has a lateral end. In this picture to the right, the medial end is indicated by the red triangle, and then the lateral end is indicated by the blue triangle. The medial end is the sternal end. It anchors or connects to the sternum, which is the breastbone, and then the lateral end is known as the acromial end. It blends with the lateral part of the scapula, known as the acromion. The humerus is the bone of the arm. So the proximal attachment is the scapula, and we just saw where the head of the humerus actually attaches, and that is at the glenoid fossa. And I'll show you an image of the head here up close and personal in just a second. And then the distal attachment here is the radius and the ulna. So the distal attachment actually makes up the elbow joint. So distal is at the bottom of the image that you see to the right of the text there. So there's the head of the humerus, and so the head of the humerus always points medially, whereas the glenoid fossa, which you saw in the scapula, is always pointing laterally. The head of the humerus then connects to the glenoid fossa, and of course that's indicated there by the red arrow that you see. So again, always pointing medially, whereas glenoid fossa is always pointing laterally. So then we have distal structures that are important to note here. We have a structure called the trochlea, and we have another structure called the capitulum. The trochlea connects to the ulna, and that's indicated by the red triangle. So this is the distal part of the humerus that's always medial. And then the capitulum connects to the radius, and that's indicated by the blue triangle there. And this is the distal part of the humerus that's always located lateral. So basically, the connection of the humerus to both the radius and the ulna is forming what we know as the elbow joint. So then we have the radius. The radius is the lateral bone of the forearm, and so it's on the same side as the thumb. So proximally, it anchors or attaches or articulates with the capitulum of the humerus, and then the distal attachment is the wrist at the carpal bones, which are the most proximal bones of the wrist and the hand. There's the radius again, close-up view here. So the two key landmarks I'd like to highlight for you are the head of the radius and the radial tuberosity. So the head of the radius connects to the capitulum of the humerus, and it also then enables rotation of the radius. So right now, you can, whether your elbow's fully extended or partially flexed, you can rotate your radius or rotate your hand right now so that your radius is rotating around your ulna. So the shape of the head of the radius enables it to rotate around the ulna. And of course, that's indicated by the red triangle there. It's a disc-like configured head there. And then the radial tuberosity is where the biceps muscle attaches. So the biceps muscle, you're probably already somewhat familiar with, is a flexor supinator. And it enables you to flex at your elbow and then also rotate your radius around your ulna. So this is the terminal attachment or the insertion site for the biceps brachii muscle. The ulna is the medial bone of the forearm. It's on the same side as the pinky. So proximally, it attaches to the trochlea of the humerus, one of those distal components, the other one being the capitulum. And then the distal attachment is the wrist. And so just for now, note that the attachment to the wrist is different when we're talking about the ulna compared to the radius. The key landmark here is known as the olecranon process. So this is the really bony part of your elbow that you feel when you fully flex your elbow, for example. So that's indicated there by the red. So right now on your cells, if you draw your forearm towards your arm, which is flexion, and then basically then point your elbow away from you, you are essentially pointing your olecranon process away from you right now. So it's the big bulky part of the ulna. So then the wrist and the hand, again, this is the most distal aspect of the entire upper limb, is composed of carpals, and we have 8 of those. We have the hand is composed of metacarpals, 5 of those, and phalanges. So in the image to your right, at the far left is phalanges, and then far right is the carpals, with the metacarpals in between those two sets of bones there. So the proximal attachment is the forearm at the ulna and the radius, and then we move distally. Far distally, we have phalanges and metacarpals, and then carpals. So let me just go backtrack here for a second. So we go forearm, and then we have the wrist, carpals, 8 of those. Again, that's the image, the far right of the image to the right there. And then distal to the carpals, we have metacarpals, and then most distal is phalanges. The phalanges are the bones of the digits or the fingers, far left in the image that you see there. So in this particular image, I've moved the wrist and hand, so you're seeing it from a different vantage point that you saw on the previous slides. So at the bottom of the image is showing you carpal bones. At the top of this image is the phalanges. So let's attach some labels here. So we have carpals. Again, we have 8 of those. Then we work our way distally. We encounter the metacarpals. There are 5 of those. And then we encounter phalanges, bones of the fingers / digits. And so we have 14 total phalanges. So note that the phalanges of the thumb, there are only 2 of those. We just have a proximal and a distal phalange, or phalanx. And then the remaining digits 2 through 5, consist of proximal, middle, and distal phalanges. So thumb, just proximal and distal phalanx. And then the remaining digits, proximal, middle, and distal phalanges. So we have 3 total in digits 2 through 5, and just 2 for digit 1. So technically that makes up 14 total phalanges. So let's go ahead and practice now. This is a little mini quiz to help you embed this information into your brain. So what we'll do for this quiz is you want to name the bone that's labeled with the digit, or the number rather, and then try to remember the key landmarks I discussed for each particular bone. So I'll pause here, or feel free to go ahead and pause the video while you figure out what the answers are, and then I'll dive into those answers for you. So number 1 is the humerus, and the key landmarks I discussed were the head of the humerus, which connects to the glenoid fossa of the scapula, and then the distal landmarks are trochlea and capitulum. The trochlea articulates or connects with the ulna. Then the capitulum connects to the radius. The number 2 is the radius. The 2 key landmarks are the head of the radius, which is the disc-like portion of the radius at the top, and then we have the radial tuberosity. Number 3 is the ulna. So remember, I referred to the olecranon process for the ulna. Number 4 is the scapula. I referred to the glenoid fossa, which is a really good lateral landmark. And then number 5 is the clavicle, and I refer to the medial end, which is the sternal end, and the lateral end, which is the acromial end. And then lastly, I talked about the wrist and the hand, number 6. So the key components there are carpal bones, far right of the image. Then we have metacarpals, and then we have phalanges, which is far left. And so the phalanges, remember, we have 14 total phalanges. We have proximal and distal phalanx for the thumb, and then we have proximal, middle, and distal phalanges for the remaining digits. So that's index finger through pinky. So what we did in this particular video, I described the bones that we find in the upper limb skeleton. So that's pectoral girdle, composed of scapula and clavicle, humerus, which is the bone of the arm, and then radius and ulna, which are making up the forearm, and then wrist and hand. And so we have carpals, metacarpals, and phalanges there. So in the next video, what I'll do is I'll talk about the lower limb video. I'll do an overview of the bones we find there, and then I'll give you a chance to practice with a quiz just like you saw in this particular video. So I got your feet wet talking about the upper limb skeleton, but if you'd like more information, including all the landmarks that we talk about related to the upper limb bones, feel free to head over to my website there, anatomyonthego.com, and let me know how I can help you learn the upper limb skeleton better. Thanks.